Welcome to Faculty Voices. Dr. Louise Ivers is director of the Harvard Global Health Initiative. She's also the director of the Massachusetts General Hospital Center for Global Health and the David Bangsberg, MD, MPH Endowed Chair in Global Health Equity at Mass General Hospital. She's a professor of global health and social medicine and a professor of medicine at Harvard Medical School. She's devoted 21 years of her life to Haiti, and that's what we'll be talking about today. Welcome to Faculty Voices, Dr. Ivers.
Thank you so much for having me.
First of all, could you tell us how you became involved in Haiti?
Yes, I started going to Haiti in 2003. And at that time in my life, I had just really completed my clinical training in infectious diseases. So I was trained up on, how to take care of infections and treat them. And in particular, I had gotten a lot of expertise in how to treat people living with HIV. And it was the time at which we had antiretroviral treatment that was out for a few years. It was very, very effective. And there was a lot of excitement around the fact that we could actually treat people now with HIV. They were getting better, their lives were being extended. And at the same time, that treatment was actually really not available to most of the world, in fact. And one of the places where it was not available yet was in Haiti. And I very fortuitously crossed paths with Joya Mukherjee, another faculty member at Harvard Medical School, and she was working with Paul Farmer, the renowned physician and anthropologist at Harvard Medical School, although I did not know him at the time. And they were about to launch a program to get HIV treatment scaled up in Haiti, where they had already for a couple of years been doing it more ad hoc. They'd been finding ways to treat patients. So together with Haitian leaders, I was able to, in 2003, go and join the program and build up the HIV program. And that's how it all began for me and expanded and extended over the years. But it was a very, very exciting time to be in Haiti and to be part of that movement to get access to treatment.
What was your first impression when you got to Haiti?
I was overwhelmed with impressions, I would say. I was so impressed by the Haitian leadership team that Partners in Health, the organization, had put together. They had been working for many years already on access to basic healthcare services. I was so impressed by the justice mission that they had. There was a very clear perspective that the work was being done not as a charitable endeavor to help poor people, quote unquote, but really it was a movement in solidarity by and with Haitians, in which we, the foreigners, a small handful of us, were really just kind of invited to be part of. So it's very, very exciting. I also, of course, had so much of the kind of social and cultural part of Haiti to embrace and to get involved in. Many things that I love too, the food and the music and the camaraderie and the language. I began to learn Haitian Creole, and it's a language that I absolutely love, that I became pretty proficient and fluent in over the years, working closely in Haitian Creole. So there was much, much, much to observe, but I was so excited. I remember coming back from that trip just being full of enthusiasm for being part of change, being part of something that I knew was going to make a big difference.
Yeah, it's a very different situation right now in Haiti. The country is quite in turmoil. Could you catch us up a bit on what is going on there from a political and public security stance?
Yes, well, I would say that since about 2018, so even before the COVID pandemic, the humanitarian situation in Haiti has really been deteriorating. And it's been a series of escalating socio-political crises. And there are intersecting issues related to politics, internal displacement, gang violence, migration, fuel stockouts, schools and businesses closing, rising cost of living. And some of this really escalated this year in 2024 in late February and early March, when there was a lot of activity that included the airports and ports being closed, a prison break occurring, prisoners being released. But the problems really didn't begin in 2024. They really predated that. I think about different eras of my work in Haiti. Back in 2010, it was a very, very disruptive time, very difficult time for Haiti. A huge earthquake in 2010 caused maybe about 200,000, 300,000 deaths. It's still not even really known how many, but it was a massive loss of life. About 1.3 million people were displaced then in 2010. And then later in that year, there was a huge cholera outbreak, which ultimately claimed the lives of about 10,000 people at least, caused about 800,000 cases of cholera. So over this time, from 2010 up until 2018, there were many challenges in Haiti. But we saw in 2018 cholera cases going down, things maybe starting to improve from a health perspective. But then there was a social movement around trying to understand what happened to development funds that had been given to Haiti or promised to Haiti. And people began to build up of asking questions about what's happening, what happened to these funds, where is this money? It was money related to petroleum funds. And from 2018 onwards, we see this intermittent series of social protests about what's happening, problems in the legislature. So elections were not held. So slowly but surely, numerous elected representatives in the government were no longer in government. And we had a president that was not yet holding elections. And then in February of 2021, that president was assassinated in his home, and things just really, I would say, from that time continued to escalate. The crisis is complex. Many others, including political scientists, Haitian, others have written extensively about this. I'm pretty focused on the humanitarian situation, the health situation, and what I can definitely tell you is that what's going on sociopolitically is definitely impacting that really a lot.
So, what are the implications of the situation for public health?
It's devastating for public health, and it's devastating for the most impoverished people. I think this is what we typically find in situations like the people who least have the resources to be able to be resilient to social shocks and political shocks. They're the ones who are most harmed. One of the big, most obvious things that we've seen happening is that in early 2022, there were no cases of cholera reported in Haiti. In fact, it had been 2 years since any cholera case was confirmed in the country, and there was a lot of public health happiness over the fact that it seemed like after 10 years, there was control of the very devastating disease. But then in October of 2022, we saw an outbreak again. And our team has actually been doing some investigation with the Haitian Ministry of Health to understand, well, why did cholera come back after 2 years of seeming to have no cholera? And what we really can see is that it's very specifically connected to a period of time where in Port-au-Prince, there was a lot of difficulty moving around because there was so much gang violence happening. There was also a chokehold on the port where fuel enters the country. So there was no gas for cars or motorcycles to move around. It was being held at the port. And literally people, including humanitarian actors, hospitals, clinics, they were measuring out the fuel that they could use in cupfuls. And it was very, very difficult to get. And exactly around the same time, we hear from communities in a very dense neighborhood of Port-au-Prince that they were not able to get water trucks into the community to sell them clean water. So most people in these very dense urban areas are relying on purchasing their water. And the water trucks were not able to get in because there was no fuel. And shortly around that time, we saw the cholera outbreak flare back up again. which we believe to be directly related to those things. So that's one very specific example of the outbreak of an infectious disease related to the socio-political crisis. But there's other examples as well. You know, it's very difficult at the moment to move supplies around or people around. Gangs have taken hold over major roads in and out of various parts of the country. So doctors, nurses, community health workers have both difficulty moving around, but it can be dangerous for them to move around. So many friends of mine, colleagues of mine have been the victims themselves of either kidnapping or of gun violence where their bus is held up and they have to give whatever money they have or possessions they have, or where their family members have been kidnapped and held for ransom. So those are having very dramatic impact as well on health services because it's just not possible to actually do it. When I say not possible, and I'll go back to some of the things that really always impress me and inspire me, even when it's seemingly impossible, it's phenomenal to see a number of colleagues I have, organizations that I work with who persist. They find a way, they get through, they keep emergency services over. So we are seeing some emergency services still available despite the odds. But generally speaking, it's just a really, really difficult time for Haitians to get around, do their work, and that includes the health sector.
You mentioned cholera, but what are we seeing in terms, for example, of mothers and kids dying because they can't get health care?
Some of the issues I think we're not going to know about until later. That's one of the problems in a crisis like this, I think. It's very difficult to count the impact. We know things like how many people we think are displaced. In December of 2023, there was a number of about 310,000 people were believed to be displaced within Haiti forcibly because of violence and insecurity. But I don't think we have a good handle at the moment on actually the number of people who are dying due to lack of access to services or escalating malnutrition and food insecurity. We know already that there's really devastating challenges, especially in rural Haiti, around access to nutrition. And what we can only believe and imagine is that the crisis now that's happening is escalating and making that worse. Many of the humanitarian organizations have called an alert around the notion of food insecurity and a fear of famine in Haiti, and I very much believe it. But I think to get specifically at the answer to your question may be difficult because, again, sometimes what I think we find in the most impoverished communities and the most neglected communities, the data is poor quality as well. So a lot of times deaths are undercounted because if you can't even get out in the community to deliver oral rehydration solution or to get community health workers out to take care of moms, you don't always know until later exactly what the impact is. But I think it's profound.
You mentioned Paul Farmer, and I know that he spent much time not only giving medical services, but developing a community network and training Haitians. What are we seeing on the ground today of that legacy? Are there people there involved in the current crisis who come out of that legacy?
Absolutely. Paul created with, as he would probably tell you, Haitian colleagues, a phenomenal organization that has just grown and grown. That organization in Haiti is called Zami La Santé, and that means Partners in Health in Haitian Creole or Friends of Health in Haitian Creole, and is really where Paul and his colleagues in Boston would say that the whole Partners in Health movement really began, and it has gone from strength to strength in Haiti. I can promise you now that there's a community health worker, a nurse, a doctor from Zami La Santé taking care of a patient right here today, and despite the odds. And as I mentioned to you, that's often such a source of inspiration and hope for me, is to see that. So when I was in Haiti most recently, I was working with colleagues from Zami La Santé. They were helping me to get around. We were talking to the Ministry of Health about the cholera outbreak. They were telling me about their work to address maternal mortality and cervical cancer in Haiti. So the work is very much continuing to go on. And one of the biggest strengths of the work was that Paul always ensured that it was Haitian leadership, Haitian decision making, Haitian informed. And in fact, the community health workers, of which there are many thousands now, are usually the leaders of informing what needs to happen next. Because, of course, the people who are closest to the issues, they're the closest to the patients, to the communities. They really know the solutions. So if you listen carefully to what the community members, community health workers have to say, they'll generally speaking light your way forward. That's something Paul very much believed in and very much taught us and trained us about, to listen to communities, to listen to community health workers. So I think the legacy there is very strong. Partners in Health, Sami La Santé is one of the biggest healthcare providers in Haiti, and continues to endure despite the challenges.
Yeah, when was your most recent trip? When was this trip?
At the end of 2023.
At the end of 2023. So what did you feel in terms of security? What did it look like?
I think it was very obvious in traveling into Port-au-Prince that there weren't as many people traveling in there as usual. I would say one of the challenges that Haiti has had in having a sustained development has that been often the development partners or the health sector partners are short-term, intermittent, come and go types of folks. And one can often see them on the airplanes. And I sometimes call them the T-shirt brigade. I mean, I have T-shirts, but I use that to kind of allude to crowds of people, groups of people who are coming and going and coming and going. Definitely at the end of 2023, on the flight into Port-au-Prince, the people traveling there were less of the international humanitarian brigade and more local Haitian leaders or people, ordinary people coming and going back to the city. So I think in terms of security, it was very obvious that the situation was not as safe and secure. I mean, typically a few years ago, I would have driven myself around Port-au-Prince. One can go out and walk around. It's not the kind of place where you had to be very careful, but now people were being much more careful. There were certain times of day and night that folks didn't go out. What I found very interesting was that many communities were taking their own security really into their own hands. In fact, there were some streets that had been blocked off by the community members themselves by vehicles, where they would just block the road so that they could try to protect their own street from gang members or others coming in with their vehicles. And then there were still some parts of Port-au-Prince at that time that the police had good control over. Since that time, I think that has even deteriorated further. But it was definitely a different situation than I'd experienced in the past. However, I will say that also people were going about their daily business. The markets in the capital city, the markets were happening. Uh, you know, Resiliency is a term that I think is sometimes overused by those of us in positions of power and privilege, because we like to say, oh, the poor are so resilient. But so I don't mean to diminish the people in Port-au-Prince by just calling them resilient, but I will say they're very clever and smart and capable of managing their own situation, by knowing when to go to be selling their market wares and when not to do that. But at the same time, those people are really very much dependent on their daily activities. So they must they don't really have a choice but to be resilient, to try to keep going and getting through the day. But I definitely was able to sense a real difference during my last trip there.
On your last trip, did you see something that made you sad?
You know, I'm often seeing something that makes me sad when I go to Haiti. Unfortunately, I try to make sure that I'm seeing as much positive in terms of helpers and people helping. I do think it was sad to see such a devastating impact on the environment, actually, in Haiti. One of the downsides of the problem related to fuel and public services and a reduction in social services has been to see a large amount of waste material and trash to be piling up in certain parts of the town and the city in Port-au-Prince. And I think that just makes for a very difficult physical environment for people. And it's obviously bad for public health as well, as we think about wanting people to have access to clean water and sanitation for their own health. But I think the climate and ecosystem impacts on Haiti as a small nation are also really problematic. And I think we'll see how climate change has a lot to contribute to what happens in Haiti as well. It certainly makes me sad to see the physical environment deteriorating. But it also makes me just really sad to see what's happening in the country now really is related to our own government's actions and inactions. So, being there in solidarity with Haitian people who I've worked with for a long time, that we have shared projects with, is always uplifting. But I certainly feel, on the other hand, that my own government here in the United States should be doing more, could be doing more, and unfortunately contributed in many ways to the way the situation is now. That certainly makes me sad.
Could you be more specific about that to our listeners who don't know too much about Haiti?
Well, the history of the US and Haiti is storied and long, including the occupation of Haiti by the US. But if we go to more recent times, I think, even over the last couple of years, since the assassination of President Moise, Haiti has had a de facto prime minister. He had not actually been properly appointed or at the time that the president was assassinated. But the US really decided to support him and uphold him, really until the point where it became impossible for them to continue to support him. He's now in exile and has promised that he'll be transitioning power to a presidential council as they're put in place. But the US has always really both overly interfered and neglected Haiti at various times in its history. I experienced this as a person working in the humanitarian space, but I don't want to overly propose in details about the political history of Haiti because I'm not an expert in that area. And I don't want to misquote an era or a date. What I'll say is there's some really good books that I could recommend to listeners to read. In fact, there's a book called Aid State by Jake Johnson, which is a really fantastic current volume that just came out. It's called Elite Panic, Disaster Capitalism, and the Battle to Control Haiti. And I think for listeners who are interested in a current status of who's involved, how the United States and Canada and France interfere with Haitian politics, how things happen in the background that we don't necessarily always see in the foreground, and how much control and manipulation there is. It's really important background and gets a little bit to my point about our contributions to what's happening in the country.
What's the role of humanitarian aid in contributing to what's happened in the country? I'm not asking about Partners in Health, which has a very philosophy, but in general, I would like to know your opinion. Some people think humanitarian aid has made Haiti too dependent. What for you is responsible humanitarian aid And is it possible right now?
Humanitarianism is very important. So I think we need to help people, assist people. We need to save lives. I think as a humanitarian, it's important to do that. The challenge is how it's done. I'm a big believer in that the how matters. And unfortunately, what we often see is a temporary interventions, a kind of band-aid approach to just putting a band-aid on the problem, not trying to solve the problem. We see kind of charitable endeavors that, oh, we must go. There's about the response. I much more believe in the idea that this humanitarian work is actually owed to the people of Haiti. I believe that some of us are comfortable in this world because others are uncomfortable. And so I see humanitarianism as a justice act. And I believe that by long-term investment in solidarity with the people of Haiti, there is a lot that we can accomplish. To blame humanitarian aid, I would say that the way it has often been done in the past has held the power of what should be done, and the resources to pay for it have been held by foreigners, by outsiders, by elites, by largely white folks. And the way it could or should be done is to do it together in partnership, led by Haitians, prioritized by Haitians, with Haitians having agency and control over what happens. If you look back to 2010, when I described the major earthquake that happened in 2010, and subsequently that year, a big cholera outbreak. Now, cholera is really related to having poor water and poor sanitation. Now, one would think that over the course of 13 years, there might be transformative change in water and sanitation. The cholera outbreak in 2010 was the biggest in the world at the time. And Haiti is a pretty small population, about 12 million people. It was a massive, massive outbreak. And people pledged and promised humanitarian assistance, development assistance. They patted themselves in the back. Countries said they were giving millions of dollars for this and that. But if you look at the statistics from UNICEF, the World Health Organization, about water and sanitation in Haiti, there's barely been a shift. I mean, there's a tiny shift in access to water, clean water, and access to sanitation, but it hasn't been a transformative shift. It hasn't transformed. So to go to the question of how has humanitarianism helped or harmed, I would say, well, we could have helped because we could have, together with the Haitian people, ensured that there was a transformative shift in access to water and sanitation, but we didn't. So what did we do instead? And was it actually harmful, maybe to even make it look like we were going to do that, to say we were going to do that, to pledge money to do that, and not to actually do it? Because then it allows people to just somehow blame the poorest Haitians, like blame them for not having soap to wash their hands, blame them for getting diarrheal disease, when actually we, the powers that of we and the large governments and bilateral organizations, we actually failed to deliver. So to summarize, I would say I believe in humanitarianism. I believe that the how the work is done is very important. And I think we really need to shift the way that international development and humanitarian work happens to have its biggest impact. But I think it still has a role because it does save lives and it does help to alleviate suffering.
What is the role of civil society, of Haitian civil society in all this? Are things being done in Haiti and the diaspora to achieve a better life for Haitians?
Haitians really taught me a lot about civil society. In fact, when I first moved to central Haiti in 2003, one of the first groups that I came in contact with were local Haitian peasant farmer organizations, and they call themselves peasant farmer organizations, that had a lot of activities together. They worked together in a way that's called combit. So when it came time for harvesting, they came together to harvest different fields, they planted together. There's a real community sense of working together. So I learned the power of that when they were organized and came to our clinic where I was working to talk about what they needed or what would be helpful for them. And I saw this again after the earthquake in 10. So I worked in the humanitarian response after the earthquake in 2010, including in a displaced persons camp, where there were about 40,000 people from urban Port-au-Prince that had moved into a disused military airport field. And when we arrived, it seemed a bit unwieldy to know where to start in our work, but very quickly I found representatives from Haitian organizations that had come together to organize themselves into the livelihoods group, a women's rights group. It was really fascinating and informative. So I tell you that to kind of add color to the fact that Haitian civil society is very strong. There is a lot of civil society dialogue about the governance, the politics, the Haitian approach to a political future. And that's partly why I even shy away too much from trying to explain what's going on, because there are many local experts who will tell us what's going on. There's some fantastic politically active young people, some phenomenally inspiring women in politics that I listen to and pay attention to. So I think the solutions are there. The Haitian-led ideas, Haitian-led solutions are all present. And what we need to do, we being outsiders, foreigners, is really lean back and have our ears open and listen and be willing to put egos aside and our thinking that we know it all aside and allow Haitian solutions to move forward. I think they would be very successful.
I think that's a wonderful place to wrap up. Do you have anything that you would like to add to the conversation?
I'm really grateful to keep Haiti in the spotlight. So much for inviting me.
Thank you. You've been listening to Dr. Louise Ivers. She is a professor of global health and social medicine and a professor of medicine at Harvard Medical School. She's devoted 21 years of her life to Haiti. Thank you for being on faculty.